Good afternoon, everyone. I would like to ask to excuse myself for speaking Portuguese, but my English vocabulary is very small, and I wouldn't be so comfortable speaking with you in English. So let's go. So the topic of today's talk is based on this chapter that we wrote for this book, the Handbook on Spirituality, Belief Systems, Societal Impact, and Roles in Coping. The chapter was written by me and by Giancarlo. The idea is to give a general panorama of Spiritism and the role of Spiritism in medicine, in health, and in Brazilian society. So to give you a brief introduction, to give a basis for the topics that we're going to be talking about. Several studies have been published in recent decades showing the impact of spirituality on health. And these religious beliefs, the spiritual beliefs, have been associated with a better quality of life, less depression, less prevalence of depression and anxiety, less mortality, better physical health, and other physical expressions of health. In Brazil, there's a very strong belief that spiritual healing could act as an important way of complementary therapy for treating medical diseases, especially in treatment of symptomatic and mortal diseases. As the other speakers have said before me, Spiritism is the third largest religion in Brazil, with approximately 2.3 million followers. And it has a particular profile of believers. Most of the members or followers have at least 60% have 11 years of studying, and the population is quite a bit above the norm for Brazil. So Spiritism was founded in France by the educator and teacher Hippolyte Léon Denisard Revel, better known as Allan Kardec. And Allan Kardec became interested in the moving tables, noises, physical phenomena that exist in materialization within Spiritism, and he decided there to carry out studies about these phenomena. He compiled a series of questions and working with doctors who on the interface between the spiritual world and here. He questioned the spirits about different aspects and matters. From this methodology, the scientific methodology, which is well-based, in 1857 he published his first book, which was the Book of the Spirits, or the Spirits Book, with 1,019 questions covering a lot of different matters, for example, the nature of spirits. During his life, he always strove to link experimental science with religion and defined Spiritism as a science which deals with the nature, origin, and destiny of spirits, as well as their relationship with the corporeal world. Kardec always encouraged or emphasized the triple aspect of the spirit, which is not just science, but also its philosophy and religion. So, in accordance with some recent studies, more than 1,650 Spiritist centers in Brazil. Recently, I did a review for my thesis, for my master and doctor's thesis in Brazil at the University of São Paulo. And the thesis only covers the city of São Paulo. And within the city of São Paulo, we were able to, through the internet methodology, we're able to find approximately 500 Spiritist centers in the city of São Paulo. So this number is probably greater than that, because we know that there are lots of Spiritist centers that study, that work in the back of somebody's house or family meetings. So the number is probably greater than that, and disseminated by everybody. So there's Spirit all around the world. And besides that, practitioners of other religions, Catholics, Protestants, Jews, make use of the Spiritist centers in seeking spiritual treatment, looking for a cure itself or to relieve their symptoms. Many of these centers claim to have excellent outcomes using therapies such as prayer, fluidic water, spirit education, and disobsession or spirit release. Some successful cases using Spiritist complementary spiritism were reported by Dr. Ignacio Ferreira in 1930, 1940. He reported that at least approximately 41% of the patients were cured through these therapies. Recently, Federico Leão evaluated the impact of spiritual practices in the clinical and behavioral evolution of behavior in patients with mental disabilities in a Spiritist health institution. He found that spiritual practices, in this case used disobsession or spirit release therapy, presented positive results on clinical and behavioral evolution of these patients, principally in the behavioral area of these patients, where the patients chosen to have mental disturbances. We need to have more studies in this area to do a more thorough analysis. Recently, a bibliographic review was done of the therapies, which was presented very well before, so we're not going to look very carefully at that now. The object of ours that we have today is to do an analysis of the role of Spiritism in Brazilian medicine and society. So to do a summary, I'd like to make it very clear that it's really just a summary. The role of Spiritism is really much greater. We just picked up some important points to cover. And we're going to discuss basically 9 different topics. The patient search for complementary medicine, the history of spiritual healing, understanding a little bit about this connection between medicine and Spiritism, how it works. Then we're going to go over the scientific evidence that have already been presented quite thoroughly here, articles that cover specifically with Spiritism and health, views of the Brazilian society in general. Also, we'll talk a little bit about the roles of Spiritist hospitals, of the medical Spiritist associations, and what we consider to be directions for future research. So, the patient's search for complementary medicine. Complementary medicine, or alternative, has grown drastically in recent decades. Our patients are avid for this. They're anxious to see spirituality increase within our clinical practice. Here in the United States, at least 40% of patients use some type of complementary therapy. Very similar results are found in Australia, which this work from 2006 showed that almost 70% of those interviewed had used at least one of the 17 forms of complementary medicine that had been studied. And 44% had visited a physician who had done complementary medication. What are the most common reasons for looking for complementary medicine? To avoid side effects of regular treatment, conventional treatment of Western medicine, because a friend or coworker or neighbor in Brazil, we play a lot, the manicurist indicated and recommended the treatment because conventional treatment had failed to cure the problem. For philosophical reasons, the patient follows a particular religion or philosophy, such as Buddhism, or because they prefer to deal with the problem by themselves in a different way. Oh, maybe older people in the family, father, mother, grandmother, had already had experiences with these complementary treatments with good results. So very quickly talk about spiritual healing, the history. The oldest cultures up to the modern times, spiritual healing has always been a part of human life. It's always been present. In primitive societies, shamans and medical men, medicine men, use prayers, chants, talismans, herbs, and potions, and teas to try to influence their patients through other means that at the time didn't exist. The technology didn't exist that we have today. Jesus was considered a great healer. We see the stories in the Bible and the Gospels tells of the numerous individual and group healings by Christ. The Bible talked about those many cases of people who got cured, whether they were individual or in group, carried out by Christ or the apostles. They used words, prayers, touch in a certain way, like a pass, faith and compassion. In the Christian era, many priests apparently were selected for their healing gifts. They healed by laying on of hands and prayer. And the rites of ordination of priests included a prayer as a way of passing on the healing power. Starting in the 1950s, there began to be epidemiological studies showing the importance of religiosity and spirituality for the patients. And they have triggered several research lines on the topic, which leads to complementary treatments, spirituality treatments based on evidence. Besides this, medical schools from around the world have incorporated spirituality, religiosity, and health within their curricula, their medical curricula. And they even go into the field of spiritual healing within the various other subjects, mentioning intercessory prayer, prayer for oneself, Reiki, Jure, and these treatments are growing a lot in Brazil. We have things going forward, but in the United States, it's really much wider, thanks to Christina Pushhouse for Guiche. In England, there's also a heavy movement in this area. Understanding the connection between medicine and Spiritism. Medicine, according to medical Spiritist paradigm, includes three sites of action principles: the spirit, the paraspirit, and the physical body. And each therapist acts on a different part of the individual. So within the physical body, we have the medical drugs, medications, we have surgery, physical procedures like phoniology, physical therapy, which act on the physical body. Finally, a whole range of treatments of traditional medicine which work directly on the physical body. In the perispirit, we need to remember that within the Spiritist philosophy, the perispirit is connected to the physical body, cell by cell. In this way, the acting on the perispiritual field of the individual can modify the physical body, depending on the intensity of the energy that's projected and the merit of the person. The pass or the laying on of hands, which does a transfusion of magnetic energy, can change the perispiritual field, changing the cellular perispiritual field, and this modifies, as a result, the body. This obsession, we think that the process of obsession is a negative influence that's persistent from another spirit, another individual, and this connection of obsession occurs to a perispirituation, paralyzation. So as you do the disobsession, this is also an act performed on the perispirit. Fluidified water can be magnetized. It acquires properties for health, curative properties. And this also acts on the perispirit, contributing to restoring the physical body. And spiritual surgery without cutting, the association is against spiritual curing with cutting. This is a medical procedure. So within spiritual surgery, there's surgery done as spiritual fluids. And the therapists that work on the spirit, and we need to think. We have the spirit, the perispirit, and the body. The spirit, the body, is the image of the perispirit, and the perispirit is the influence of the spirit. If we do therapy on the spirit, the moral modification of the spirit, obviously this leads to a modification of the whole chain, the perispirit and of the physical body. So some therapists, the education of the spirit, do the education of the spirit through influence, moral evolution of the spirit, moral values, cultivation of love of oneself, of humility, purity and peace, compassion, charity. Without charity, there's no salvation. That's nothing more than love for one's neighbor. Prayer that one makes, when you pray for yourself, this is nothing more than an intimate contact with God and with the greater spirits, superior spirits. So you transcend yourself, and this modifies the spirit. When you talk about the intercessory prayer, we do a prayer for somebody else, and the action is more on the perispirit, as if it were a pass, but we do a vibration for another individual. Scientific evidence. The systematic review that Giancarlo talked about, I think, clarifies a lot about what we have in terms of evidence about prayers, processes, fluidified water, charity, spirit education, and spirit release or disobsession. There's still a lot to do to bring together, but we have a direction to follow. There's moderate to strong evidence that volunteering, doing charity, is associated, has good health effects. The laying out of hands, virtuous life, praying for oneself also seem to be associated to positive findings. And there exists a lack of more solid studies involving magnetized water and spirit release therapy or disobsession. So, with this review in a certain way, science is showing indirectly that some of these therapies can be associated to better health outcomes, and that other therapies have been overlooked, things that may have been forgotten about. There are some articles dealing specifically with the relationship between Spiritism and health that were published in the medical literature, and more articles need to be done. I'm going to show those that have already been done. An interesting article where Spiritist mediums are analyzed was Alessandra Granero and his collaborators who evaluated the similarity and the differences among spiritual mediums from Brazil and patients with disorders of anxiety and associative disorders. Even because due to mediunity, the patient who felt a spiritist psychosis, a psychiatric condition, and what was seen in this work. Doctors presented a better social adjustment, lower prevalence of mental disorders, lower use of mental health services, especially mental health services, the no use of antipsychotics, lower prevalence of histories of physical or sexual childhood abuse, lower prevalence of sleepwalking, lower prevalence of secondary borderline personality situations. Psychically, the Spiritist medium was more healthy than a normal member of the community. This is the theory that psychiatry had of spiritual psychosis. This study that Frederico Leon did, he conducted a randomized, double-blind trial that evaluated the impact of disobsession, spiritual release therapy in clinical and behavioral evolution of patients with mental disabilities who had been hospitalized. And they found improvements in the progress of these patients who were submitted to disobsession in comparison to those who did not receive that treatment. The treatment, clinical treatment of disobsession or spirit release. The views of Brazilian society. At the beginning, people who are opposed to Spiritism attacked psychic practice and defined it as a cause of psychopathology, as I said. In 1858, 1 year the publication of the Spirits book in Brazil, stories of people who were alienated during spiritual practices were reported in Europe. And until the middle of the 20th century, the prevailing position in psychiatry was to reject Spiritism and mediumistic practice in general. But this changed in recent decades. Why? Within our International Code of Diseases, the DSM-4 or ICD-10, which is DSM-10, which is the mental disease classification, trance and possession were considered to be sociological rather than pathological when they were related to the sociocultural context. See, if a person, the religion that the person professes has this practice, it's not considered to be a psychosis. It is considered to be pathology. And from there began to be departments of psychiatry that were transcultural within the universities to study these phenomena. Excuse me. The present time views the form of treatment of Spiritism in mental health has a lot of support for this kind of treatment, especially in the middle class that has access to complementary medicine and among health professionals, especially psychiatrists. According to Soares, in 2008, who wrote an article evaluating the discourse of Spiritist physicians in Brazil, Spiritism is bringing back the spirituality in Brazilian medicine. Now I'm going to talk a little bit about summarizing Spiritist hospitals, the practice of Spiritist hospitals in Brazil. During the 20th century, many psychiatric hospitals in Brazil were founded by followers of Spiritism, aiming to associate or integrate conventional medical treatment with complementary spiritual therapies. So one was not separated from the other. In some cases, as was shown in the previous slide, were reported with quite a bit of success. A study was a thesis, a doctoral thesis, dissertation, carried out in Unicamp in 2004. A review was done of 16 hospitals, psychiatric Spiritist hospitals in São Paulo, and what did he find? He found these hospitals were responsible for 6,500 hospital beds, 4,300 professionals, health professionals tied to these institutions, 950 volunteers who applied the Spiritist therapies, and these hospitals represented These hospitals represented 50% of the psychiatric beds available in the state of São Paulo at that time. That is, it's a number of hospitals and treatment offered that's really quite large within our reality made of the study in São Paulo. Usually, spiritual therapies are conducted by volunteers who do not receive payment for this to carry out these therapies within the hospital. They're mediums who normally work in other centers, and they're not associated to the hospital. Occasionally, there may be one or another collaborator of the hospital who happens to be a spiritist and who works in mediunic disobsession, but he does this outside regular working hours and is not paid to carry out the mediumistic activity. Most of the Spiritist hospitals have the following treatments associated with conventional care: fluidotherapy, lectures and studies regarding Spiritist disobsession, prayer, and fraternal care. Fraternal care is an interview with a person where the person converses and talks, directs the person who has come for help. This article was written where 6 Spiritist hospitals were evaluated, the closest ones in, and how they use the Spiritist therapy. This article was published in Culture, Medicine, and Psychiatry journal, and it was evaluated by the Baihal Society, which is in Baihal, psychiatrist in São Paulo, the Saião Clinic, the André Luiz Hospital in Belo Horizonte, the Porto Alegre Spiritist Hospital in Rio Grande do Sul, the Bom Retiro Spiritist Hospital in Panama, and the João Evangelista Hospital. I'm going to go quickly talking about how things work in the João Evangelista, the hospital that's closest to us, so that you can have an idea of how it works. This is this physical structure of the hospital. We have the nurses' areas, the dining area, the rooms, and the hallway, the patios, the area for occupational therapy, the playing area, so that you can have an idea of the physical structure of the hospital. Here, there's a photo of the disobsession or spirit release carried out within the hospital. The pass or prayer is done for the patients who are in the hospital who want to or manifest a desire to taking a pass, or their collaborators express that interest. So the laying on of hands, right? The reading of the gospel, the speech open to the public, so that people who may feel free to come in and look for this. Fluidic water, magnetized, which is distributed after the spiritual treatment. I'm going to talk a little about the medical spiritist associations. The medical spiritist associations are philanthropic institutions that aim to promote spirituality and spiritism in medical care and to study the impact of spirituality and religiousness within the Brazilian population. The first association was founded, as was shown on the video, was the São Paulo Medical Spiritist Association. It was founded in 1968 when Dr. Marlene Nobre received a psychographic message, the Decalogue of the Spiritist Doctor. If you have the opportunity on YouTube, there's an English version of the Decalogue. It's very beautiful, talking about the mission of the medical spiritist. Since the AMEs have spread throughout Brazil and around the world. This is the photograph of the first meeting of the doctors at the founding of the Medical Spirit Association in São Paulo. Excuse me, but in Brazil we have AMES in almost all the states of the Federation, from the north, northeast, central, east, south, southeast. The international AMEs, we have some, but there are some others too. So we have Brazil, Guatemala, Panama, Portugal, United States. Medinesp is our national congress. The next one will be held in 2013. It was held in 2011 in Belo Horizonte. These are the photographs that I had, private ones that I took in 2009, so that you can have an idea of the size of the event. Generally, they take place in large auditoriums with 1,000, 1,200 people, often carrying out also simultaneous breakout sessions. So you can see the tables with the international speakers. This one, 2003, we had the Harold Connie. And the AMEs promote conferences around Brazil and in the world. So in Germany, this is the 5th conference in Germany of Medicine of the Soul here in the United States. This Congress that we're all attending right now, the 4th. In Great Britain, the 3rd British Conference of Medicine and Spirituality. Portugal is going to have its 7th journey, Portuguese journey of spirituality and medicine. In Holland, the 3rd Congress is being held in Switzerland, in Belgium, France. In France, there's going to be the 5th Francophone meeting of spirituality and medicine. A lot of courses are given on spirituality. They've been introduced within the universities of medical practice in Brazil by members that have been affiliated with the AMEs. Some examples: the Federal University of Ceará, Federal University of the Mine Triangle, and the closest one to us, which is through our association, São Paulo, the Taubaté University, where professors from there, Dr. Alessandra, in partnership with the association, we set up the curriculum of the optional course within medical program. It's very good to see an open course to 20 listeners. Or the spaces were all filled, and there were an additional 20 people who tried to get in the class without credit, so it wouldn't weigh down their grades, but they couldn't do it because there was no more space. Examinations. AMEs are also responsible for research in health areas. We had the chance of showing in this Congress some of our research work, and presently it's one of the most productive institutions in scientific articles in our country in this area of spirituality. Here, so you can have just an idea of the publications that we already have up to now in the Journal of Medicine. These are articles in both indexed journals as well outside of Brazil, as well as those in Brazil, trying to promote and raise spirituality within the practice of the universities, of the academic world in Brazil. Here's some more. We've already talked about Adurel on the scale of spirituality in Portuguese in Brazil. Here up to 26 articles published in very important journals. Some of our partners, Koenig from Duke University, Christina Bullhouse from this university, George Washington University, Alexander in the Federal University of Juiz de Fora, and I'm doing my doctorate dissertation within the USP, University of São Paulo, and we participate with the João Evangelic Hospital, and various other important research institutions are affiliated with us. Participation in Brazilian medical conferences, Brazilian Psychiatry Congress. We set up a table, talk about spirituality, geriatric, internal medical conference, rheumatology congress. It's going to be next month in October. Brazilian Medical Education Congress, Neurology Congress of São Paulo, and the meeting of the Cardiology Association of São Paulo. Future directions for research. We believe that the research field of spiritual practices, Spiritism and health, is a very promising area for research and the use of complementary medicine and alternative medicine. Nevertheless, there is a lack of study, and there are very few studies dealing directly with spiritual healing and spiritual therapies and spiritist and spiritual therapies. So, in conclusion, spiritual healing beliefs are common in our society, Brazilian society. We can see through various studies the concomitant use of spiritual and conventional therapies are quite prevalent in Brazil, in spite of our not having a measure of this, but during our clinical practice, we observe this a lot. The Catholics, evangelicals are looking go to the Spiritist Center to get a blessing. And all of this should lead to greater discussion of the matter of spirituality and medicine and of health. This is just a little bit about what I wanted to pass on, about the general panorama of the situation in Brazil and the importance of our making this connection between spirituality and Spiritism with medicine, our practice, because for our patients, this is not disassociated. We have done this over the period of history. Thank you very much.